Dear friends, good morning. I am Dr. Mathur. I am an endocrinologist at Max Hospital, Mohali, primarily looking after diabetes. We are actually trying to fight out together to de-diabetes India. That is, we want our country to be free from diabetes, and at least if we can manage the diabetes patients well and prevent their complication. And one of the major important aspect of this de-diabetes is a blood sugar monitoring part. I'll speak on that. We have to realize the importance of monitoring blood sugar, because if you monitor your blood sugar regularly, so whenever you visit your doctor, at least he knows what is your blood sugar status. Now, if we have to do a blood sugar at home, it's a very simple procedure. We only require a blood glucose monitor, which we call a glucometer. It's a very simple device, and now we have very economic and cheap devices with which you can monitor your blood glucose at home. Because whenever you visit a doctor, if you have multiple readings of blood glucose monitoring, possibly he can address your diabetes better, because he can exactly know where you are needing a modification in your drug schedule. And also you have to be very well aware about the low blood glucose. That also you can know only when you are using a glucometer. Of course, your doctor will teach you about the low blood glucose management at home. What are the signs and symptoms like anxiety, tremors, sweating, double vision, confusion. There could be a lot of symptoms with low blood glucose, which you can recognize very well if you are equipped with a simple instrument to fight diabetes. To de-diabetes is a glucometer. Now even the cost of the strips have come down quite cheap. I believe these days you can get a strip for a cost which is as low as 7 to 10 rupees. So it's a very simple thing to monitor at home. Do monitor your blood glucose at home. Make a chart of your monitoring. If you are well controlled, still you need to monitor your blood glucose once a week. And if you are not controlled, your diabetes is not well controlled, your doctor may ask to do a frequent blood sugar monitoring. So once a week blood glucose monitoring at home, once a month blood glucose monitoring through lab, once in 3 months getting HbA1c. So these are some of the monitoring targets which we need to do, which we need to perform, which we need to know about if we sincerely want to work together to de-diabetes our country. Because diabetes is primarily, I believe, is two things. One is the education and second is the medication. In education, we need to educate ourselves regarding our blood glucose levels, and second is to take the medicine. Your doctor will help you in managing that. So do monitor blood glucose at home. Don't be careless, don't be casual. Whenever your doctor asks you to do a more frequent testing, go for it. Otherwise, if you are well controlled, even then you are supposed to monitor your blood glucose at least once a week. And whenever you visit your doctor, show him those readings, because he will know better about your status of your diabetes control and he can manage it accordingly. This is my message. Don't shy away from blood glucose monitoring. If you really want to control your diabetes well, you must monitor your diabetes regularly. Thank you.